वेलकम बैक। आज हम सीनियर्स की फिजिकल हेल्थ का एक बहुत इम्पोर्टेंट एस्पेक्ट डिस्कस करने वाले।
Welcome Dr. Mithila Pimparkar. She has done her Masters of Physiotherapy in Neurosciences from KEM Hospital, and she's currently working in Bangalore since the past 8 years. We will be today focusing specifically on how to prevent falls in seniors. So Dr. Mithila, my first question to you is, how do you define a fall?
A fall is defined as an unexpected loss of balance or unexpected change in posture, which leads to either landing on the floor or either landing on the nearby surface. Fall happens all the time throughout the lifetime in human beings. Children, young people fall all the time. But the big deal about fall happening in the senior citizens is that the aging body cannot cope up with the consequences of the fall. So that is why falls are a matter of serious concerns in senior citizens because the consequences of the fall are quite serious.
Thank you, doctor. What are the effects of a fall? Fall होने के बाद क्या होता है?
फॉल होने के बाद कई सारे सीरियस कॉन्सिक्वेंसेस हो सकते हैं. दे मे लीड टू सिंपल ब्रूजेस, स्किन के ब्रूजेस, लिगामेंट इंजरी, फ्रैक्चर्स जैसे कि हिप फ्रैक्चर्स, नी फ्रैक्चर्स, या यहाँ तक कि हेड इंजुरीज जिससे ब्रेन की इंजुरी का धोखा होता है. अगर यदि ये सब कुछ नहीं होते हैं तो कांस्टेंट फियर ऑफ फॉल जो है वो सीनियर सिटीजन पे बना रहता है. तो उस वजह से उनकी क्वालिटी ऑफ लाइफ सीरियसली इफेक्ट हो जाती है. दे ईदर डिपेंड ऑन देयर केयर टेकर्स और दे विड्रॉ देमसेल्व्स फ्रॉम लॉट ऑफ सोशल एक्टिविटीज, और इस वजह से उनका इंडिपेंडेंस काफी हद तक अफेक्ट हो जाता है.
True. And who is at risk of fall?
Okay. So basically, just because you are 65 and above, you are a senior citizen doesn't mean that you can fall. There are a lot of people who are susceptible to fall. Aging, with age, there are a lot of age-related diseases which are come along. Like if you have uncontrolled diabetes, because of which the sensations your feet are affected, so your judgment of the floor, your balance is affected. So those senior citizens are at the risk of fall. Many senior citizens have Parkinson's disease, so the balance is affected. If you have stroke, you are susceptible to fall. Many senior citizens with age-related changes, they have joint arthritis of the legs and bodies, slip disc. They are susceptible to fall. Many senior citizens who are morbidly obese and they are dependent on some walking devices, they are susceptible to fall. So age-related changes vision में तो आते ही है. If you have reduced visual acuity या फिर cataract है, तो then you are susceptible to fall. Age के साथ there are some changes in the inner ear जिसे हम vertigo कहते हैं, तो उस वजह से भी आपको fall हो सकता है.
Great, thank you so much. और कोई changes होते हैं in more other than what you just explained to us, और ये changes जब होते हैं तो हमारा immediate environment जो seniors का होता है वो कैसे हमें modify करना चाहिए ताकि falls का जो risk है वो minimized हो?
Right. तो fall को हम fall के कारण जो है हम दो तरीके से देखते हैं मेडिकल फ्रेटर्निटी में. एक तो हम देखते हैं कि इंट्रिंसिक फैक्टर्स, मतलब जो इंसान है उसकी अपनी बॉडी में जो है उसे हम मॉडिफाई करते हैं कि जिस वजह से उनका इंटरेक्शन विद देयर इमीडिएट एनवायरनमेंट इफेक्टिव हो. काफी बार उनका इमीडिएट एनवायरनमेंट जो है उनके साथ उनका बॉडी कोप अप नहीं कर पाता है, जिस वजह से ट्रिपिंग एंड फॉलिंग होता है. तो आई विल टॉक अबाउट द फैक्टर्स. आई विल टॉक अबाउट द इमीडिएट एनवायरनमेंट लेटर, बट फर्स्ट आई विल टॉक अबाउट जो बॉडी के चेंजेस है हम उससे कैसे कंट्रोल कर सकते हैं कुछ एज रिलेटेड फैक्टर्स को, जिस वजह से प्रिवेंट कर सकते हैं. फर्स्ट ऑफ ऑल, रेगुलर मेडिकल चेकअप्स, रेगुलर ब्लड लेवल्स, ब्लड चेकअप्स बहुत इंपॉर्टेंट होते हैं. 6 monthly checkups should be done with the physician, especially those who specialize in geriatric health. जैसे हम बच्चों को के डॉक्टर्स को पीडियाट्रिशियन कहते हैं, वैसे हम सीनियर सिटीजन्स के जो डॉक्टर्स होते हैं उन्हें जेरेंटोलॉजिस्ट या जेरियाट्रिक फिजिशियन कहते हैं. तो दे हैव अ टीम ऑफ पीपल हु वर्क फॉर देम, सो इट शुड बी डन. डायबिटीज को कंट्रोल में रखना बहुत जरूरी है, जिसके वजह से उसका नर्व्स पर इफेक्ट होके सेंसेशंस अफेक्ट होना कम हो जाता है. आई चेकअप रेगुलरली करना बहुत इंपॉर्टेंट है. अगर कैटरैक्ट बढ़ रहा है तो उसे टाइम पे उसका इलाज करना बहुत जरूरी है, ताकि विजन की वजह से फॉल ना. फिर अगर विटामिन डी के लेवल्स हमेशा चेक करते रहना चाहिए. साइंटिफिक स्टडीज ने बताया है कि अगर विटामिन डी का रेगुलर सेवन हम सीनियर सिटीजन करते हैं तो फ्रीक्वेंसी बहुत कम हो जाती है विटामिन डी अलॉन्ग विद कैल्शियम सप्लीमेंट. तो ये चीजें हैं. पार्किंसंस की अगर बीमारी है, पार्किंसंस की अगर साइंस है, तो उसके मेडिकेशन के डोजेस को रिवाइज करना आफ्टर एक अरसे के बाद उसके डोसेज को रिवाइज करना बहुत जरूरी होता है, ताकि पार्किंसंस के सिम्टम्स बढ़ के, क्योंकि पार्किंसंस एक प्रोग्रेसिव डिसीज है, तो
जी.
उसे कंट्रोल में रख के उसका मेडिकेशन डोपामिन लेवल्स कम होती जाती है, तो सिंडोपा का जो है वो लेवल्स कंट्रोल में रख के रखना चाहिए मेडिकेशन, वो बहुत जरूरी बात है. फिर उसके बाद फ्लेक्सिबिलिटी भी काफी कम हो जाती है, तो रेगुलर एक्सरसाइजेस और फिजियोथेरेपिस्ट से कस्टमाइज प्लान लेना बहुत जरूरी हो जाता है. मैं एक्सरसाइज के बारे में इस बाद में बात करूंगी. आई विल टॉक अबाउट व्हाट आर द ergonomic changes. Ergonomics is a science where you design the objects used by a person in their immediate environment so that it suits to the person. So obviously we design the immediate environment of a senior citizen in such a way that it adapts to their age-related changes uh, or limited abilities, physical abilities. So let's talk about the bed. अगर हम सुबह से लेके शाम तक का अगर रूटीन एक सीनियर सिटीजन का देखते हैं, तो बेड कैसा होना चाहिए. तो हाइट ऑफ द बेड शुड बी इन सच अ वे दैट अगर पर्सन उसकी एज पे बैठा है तो उसके पैर या पाँव के पंजे जमीन पे टेक सको. अगर वो उससे ऊपर है तो नो प्रॉब्लम. अगर द सरफेस ऑफ द बेड, सो मेनी टाइम्स द बेड फ्रेम्स आजकल इतने लो होते हैं कि द पर्सन हैज टू ऑलमोस्ट गो डाउन. इट शुड नॉट बी देयर. The quality of the bed mattress which is used should be such that it supports the spine and the curvatures of the spine, preferably a cotton mattress. Then, instead of using, so many times fall happen in senior citizen while they are rolling in the bed. गिर जाते हैं काफी बार. I'm talking about uh, very senior adults, those who are above 80 years and above. So instead of using bed sheets, if you can use bed skirts that are even better, a cotton mattress. Then the flooring of the senior citizens should be either wooden or a rough tiles, which do not give a glare. Finding a ceramic tiles or granite tiles which give glare is very common. अगर लाइट बाउंस होता है टाइल्स के ऊपर से, इतनी शिमरी और शाइनी टाइल्स है, तो उस वजह से वॉकिंग के वक्त जजमेंट अफेक्ट होता है. तो इट शुड बी इधर वुडन which do not become cold, or they help in gripping the floor while walking. So when we go to a bathroom, there should be a provision of the bathroom next to every senior's room. अगर immediately नहीं है तो पैसेज जो बाथरूम तक जाता है, इट शुड बी अ क्लटर फ्री पैसेज. ओके. सो बाथरूम के पास हमेशा डोरमैट होनी चाहिए along with a skid proof under mattress, which will the doormat should be absorbent along with underproof mattress which is skid proof. Then when we go to a bathroom, so many times we have heard stories, all of us, that fall happens in senior citizen in the bathroom. Many times I have treated so many patients who have undergone stroke because they had a fall in a bathroom and they banged their head on the wall and the stroke happened because of the brain hemorrhage. So we have to take care. This is a very crucial area, or this is a very important area where fall happens quite common. So अगर अगर देर इज अ नो न्यूरोलॉजिकल कंडीशन इन अ पेशेंट, जैसे स्ट्रोक से रिकवर हो चुके हैं, पार्किंसंस है या डायबिटीज से न्यूरोपैथी है, मतलब सेंसेशंस अफेक्ट है, इट इज वेरी कॉमन कि उन्हें समझ में नहीं आता है ठंडा गर्म, या फिर पाँव के नीचे अगर छोटे छोटे कंकड़ आ जाते हैं वो भी नहीं समझ पाते हैं। इसका मतलब है उनके सेंसेशंस काफी हद तक अफेक्ट हो चुके हैं कि उन्हें जजमेंट नहीं आता। तो देर आर लॉट ऑफ रबर मैट्रेसेस which have some kind of a design because of which water goes underneath, but when a person walks on the surface, not walking on a watery slippery surface. So mostly there can a track which is leading from a commode up to a door entrance should be there. It is very important for all the seniors who are above 75 and above, because falls happen commonly in bathrooms. There should be the toilet which is being used. The toilet seat should be a Western toilet, because as we just discussed that with age, arthritis is a common complaint. So if there are people, if senior citizens are visiting briefly to somebody's home, or they are being taken care by somewhere पे जहाँ जिनके यहाँ पे western toilet नहीं है, so they can use a chair, a commode chair which comes, a chair which has a hole or a provision of the toilet seat. It should essentially be a western toilet, and the height of the toilet should essentially be 16 to 18 inches, because it has been shown that 16 to 18 inches is a height, is an optimal height through which getting up from a sitting posture is easy. It is a biomechanical factor. So kai baar that is also not enough for senior citizens. So they cannot generate a strength to get up and get down. So grab bars should be there next to a commode. We have seen in so many malls and airports that there are horizontal grab bars in a differently able or handicapped toilets, but it should be the provision for a senior citizens in the house, because so many times hip fractures happen while getting up from the commode. So grab bars can also be provided throughout the bathrooms, where they can grab if they have so many senior citizens, if they have fallen previously, if they are falling many times, then they always have a fear of falling. So so that they should the independence should be promoted. There should be provision of the grab bars throughout the bathroom, and the provision for taking a bath and other things, the high surfaces, high stools should be used for them. I'm talking about elaborately about bathrooms because these are the places where falls happen. So now, if we want to talk about cupboards which are being used in the room, most of the times, especially in the elder adults, senior citizens, those are about 80, as we can see, because of the advancement in the medical field, life expectancy has increased a lot. We can see people alive and living their lives above 85. It's very common to see, but the quality of life gets affected. So in the rooms where the cupboards are there, where they keep their belongings, so many times falls happen while opening the door. Senior citizens lose their balance commonly in a backside. So because of this stoop posture. So if the cupboards which are being there, they should have either a rack doors where the sliding is being provided. Okay, so that there is no need to go back while opening the door, or they can be doorless racks or just shelves where they can put belongings. So these are the things that should be there. One very important thing that should be there, that there should be constant red light, a red light which is burning in the room of the senior citizens. So many times senior citizens leave their rooms for the evening walks, and when they come back, it's already dark in the night. And then if the light is not on, the dark adaptation is very much affected in senior citizens. So studies have shown that there are kind of cells in our eyes. They are called red cells. They adapt to a dark very quickly. So having a red light inside, which is of a very low power, helps a lot for senior citizens to adapt in the dark. So these are a few things which help. Of course, not just this. There are so many factors which can be done. A customized ergonomic design or customized evaluation has to be done for every senior citizen. But these are some common things which should be, kept in the mind uh, while having a senior citizens. While when we are involved in taking care of the senior citizens.
Okay.
Yeah.
Wow, Dr. Mithila, that was very, very valuable. All the points that you gave.
डॉक्टर आपने जो आज हमें इतनी सुंदरता और सरलता से समझाया है, थैंक यू सो मच फॉर इट. This information will definitely help our seniors to lead a good quality of life, and it will help them to be independent and self-confident. Thank you so much, and cheers to wellness.
Cheers to wellness.